If you want to have a full understanding of today's topic, watch our previous healthcare videos. So as we discussed earlier, the child that inherits genetic materials for hemoglobin A from both parents, that is father and mother, will have genetic makeup of AA, and the child that inherits S from both the father and the mother, he will have SS. And as we discussed earlier, let's assume oxygen is like a tomato and hemoglobin is like a tomato basket. Red blood cells is like a farmer. So let's see what happens. An AA is called a normal hemoglobin. It's a normal person who has AA. So let's see what happens in a person with AA, and we'll compare it later with what happens in the person with SS. So in the person with AA, the farmer, which is the red blood cells, will use a normal tomato basket, which is a normal hemoglobin A, to carry tomato, which is oxygen, to the markets. And the market is like our body organs and systems. So in normal hemoglobin, the farmer will not suffer much because the basket will carry adequate amount of tomato, and with simplicity he will take it down to the market without any difficulties. But for person with SS, the farmer would like to, in market there is competition. My fellow farmer is carrying, let's say, 100 tomato at once. So me too, despite I don't have a tomato basket like he does, but I must carry that 100 tomatoes. So he will try to use his hand, left and right, grab the abnormal basket like this. So then he will say someone to pour the tomato. So when the tomato is being poured, and he will be working like this, So as he is working, definitely some tomatoes will have to be falling on his way. So meaning, on his way, he will lose some amount of this tomato, just like the red blood cell for this person with hemoglobin S will be losing oxygen on his way to our body organs and system. So as he is walking, he is losing that tomato, like he will become depressed. My fellow farmer is carrying 100 tomatoes at once, and I try to carry 100 tomatoes. I only reach the market with only 20 tomatoes. So he will be depressed, and he will force himself to be carrying it such way, because even if he do not carry with such posture, even the 20, he cannot reach the market with the 20. He will reach the market with, let's say, 5 to 10. So he has no option. He has to be carrying the tomatoes in with such posture. So meaning he is stressed compared to a farmer using a normal tomato basket. Now, by mere looking, this farmer will be healthier than this farmer. Just like this red blood cell in person with AA will be healthier than the red blood cell in the person with SS. This farmer will be stressed compared to this farmer, just like this red blood cell will be stressed compared to this red blood cells. So this means, as time goes on, when this farmer becomes old, he will assume this posture because his back will become stiff in this posture. And this farmer, which is this normal red blood cell, will be walking erect. Despite he is old, but he will be erect because he was not stressed at his young age. So this stiffness of this back when you compare it with the stiffness of the red blood cells as a result of that stress and activities he has done during his young age. If you can take the demarcation like this, so also the red blood cell will assume a shape like this, which looks like a sickle. So this sickle shaping of the red blood cell as a result of losing of oxygen while he is doing his day-to-day activity is what we call is from this that the name sickle cell disease was derived from. So this sickle cell, when passing through tiny blood vessels, because in our body there are organs where you can find very tiny blood vessels. If this is the farmer and he's erect in the market where there are tiny passage, he will try to squeeze. Despite he's carrying the tomato basket, he will try to squeeze. He will try to squeeze and go to his customer. But for abnormal red blood cell or farmer using abnormal tomato basket, that is hemoglobin S, he will be working like this with the tomatoes. As he is working, he is pouring tomatoes. So as he's working, he will be pouring some of the tomatoes and he will be working like this. So when he reaches a passage in the market where the passage is very tight, because the market, so many people are there, so the place is tight, so he will stop. Like he will need help from people. So as he, in the market, whenever someone stays, someone will be waiting. Someone will be waiting. So before you know, the place will now be stocked by people. So they will start complaining, "Hey man, go now. I want to pass. Go, I want to pass. Go, I want to pass." So before you know, and he will be replying, "Can't you see the type of tomato basket I'm using? If I stand up, these tomatoes will pour away." So before you know, crisis will start. So as that crisis starts, it also happens in our normal blood vessels. So when they are stocked in one place, definitely there will be crisis. So that crisis, as a result of stocking of such farmers or stocking of such red blood cells, is what we call sickle cell crisis. And this crisis can lead to, because as they are fighting, the farmers, as they are fighting, one, they were depressed. Their competitors are taking much tomatoes to the market than them. So definitely they will be highly short-tempered. So they will start fighting. As they are fighting, they will start to destroy some places, busting bottles, breaking bottles, busting some places. So they will damage the area that they are fighting. So also in our blood vessels or our body organ, as they are stocked, they will damage the area where they get stocked. So this means in sickle cell patients, their organs get damaged, like the hip, bone, and other important organs in our body. So when they get stuck, this means blood circulation will not be much. An oxygen supply because of this abnormal tomato, it will be low in the body. So this will make the body of a sickle cell patient to become pale. And because they are dying young, because an old man that was stressed during his young age, when compared to an old man that was not stressed in our body, this red blood cell that was stressed, when compared with this red blood cell that was not stressed, this red blood cell will die young when compared to this red blood cell. So as they are dying, that will make what we call the anemia, that is the sickle cell anemia. And when there is sickle cell anemia, our blood volume, the person suffering from sickle cell disease will be suffering from low blood volume, and that will lead to like gasping and palpitation, like increased heart beats, so increased heartbeat, shortness of breathing, and also short growth, serious recurrent and persistent infections, presence of blood in the urine, and much more other medical problems.